The Patient Protection Affordable Care Act, also known as Obamacare, was intended to address several issues, not the least of which was to get the 50 million people that are uninsured insurance. And the second one is to start moving towards a cost control system where the growth of medical costs is reduced to no more than the rate of inflation in the overall economy. And for those people that don't have insurance, there's a multi-tiered process by which they can acquire insurance. Individuals will be able to go to state-run insurance pools. So instead of buying insurance as an individual, you will actually be able to buy insurance as a member of a large cohort. So the risk is spread out and the insurance companies will be able to charge much lower premiums. Your United States senators and all your congressmen from the state of Pennsylvania will be required to buy insurance from that pool starting in 2014. They will no longer be on the federal health care program. That's also part of the law. The law covers people who can't afford insurance with Medicaid. It supplements premiums through tax credits for people who are up to 400% over the poverty level in terms of the size of their family and their annual income. So there's every effort being made to make health insurance affordable and accessible to everyone. That's why it's such a good law. There are things about it that need to be changed. There's certain funding mechanisms that are being used that may not work as well as intended, and so we need to consider those. There's certain loopholes in the law that may lead to certain people not being able to have access to the insurance pools that we want them to have access to. These things can be changed. But the law overall is a very good approach, a very good first step. It needs to be strengthened and implemented. This is one of the ways that we're going to approach containing medical cost growth in the coming decades. In the next 10 years, the use of this law, Obamacare as they say, will save $120 billion off the deficit, off the debt. Repeal of this law will result in Medicare going bankrupt sooner, 8 years sooner, and continued cost growth and the cost of medical care. It's not an imposition on people to pay their own way, and that's the American way. You pay for your own way, and that's what we're asking people to do.